Tobacco is a major cause of cancer and can worsen its progression in multiple ways. Here are 15 ways tobacco can contribute to cancer-related deaths. 1. DNA damage. Tobacco smoke contains carcinogens that directly damage DNA, leading to mutations that cause cancer. 2. Increased tumor growth. Tobacco chemicals promote tumor growth by stimulating abnormal cell proliferation. 3. Reduced effectiveness of treatment. Smoking can make chemotherapy and radiation therapy less effective, reducing survival chances. 4. Weakened immune system. Smoking suppresses the immune system, making it harder for the body to fight cancer. 5. Higher risk of recurrence. Continued smoking increases the chances of cancer returning after treatment. 6. Metastasis promotion. Tobacco toxins promote the spread of cancer cells to other organs, leading to deadly complications. 7. Poor wound healing post-surgery. Smoking reduces oxygen supply to tissues, delaying recovery after cancer surgeries. 8. Cardiovascular complications. Cancer patients who smoke are at higher risk of heart attacks and strokes, which can be fatal. 9. Lung failure. Smoking worsens lung function, increasing the risk of respiratory failure, especially in lung cancer patients. 10. Blood clots. Tobacco use increases blood clot risk, which can cause fatal pulmonary embolisms in cancer patients. 11. Organ toxicity. Smoking worsens the toxic effects of chemotherapy on organs like the liver and kidneys. 12. Chronic inflammation. Long-term smoking leads to chronic inflammation, which fuels cancer progression. 13. Secondary cancers. Smoking raises the risk of developing additional cancers in different organs. 14. Higher infection rates. Cancer patients who smoke are more prone to severe infections, which can be life-threatening. 15. Shortened life expectancy. Even after cancer treatment, continued smoking significantly reduces overall survival rates. Quitting smoking at any stage of cancer can improve treatment outcomes and extend life expectancy. Cancer patients are highly vulnerable to infections due to their weakened immune systems, often caused by cancer itself or its treatments like chemotherapy and radiation. Infections can lead to death through several mechanisms. 1. Sepsis and septic shock. A severe infection can trigger an overwhelming immune response, leading to sepsis. If untreated, sepsis can progress to septic shock, causing multi-organ failure and death. 2. Neutropenic fever. Chemotherapy often reduces white blood cell counts, neutropenia, making it harder for the body to fight infections. A simple bacterial or fungal infection can rapidly become life-threatening. 3. Pneumonia. Cancer patients, especially those with lung cancer or weakened immunity, are prone to bacterial, viral, or fungal pneumonia. Severe pneumonia can cause respiratory failure and death. 4. Organ failure. Infections can spread and cause damage to vital organs like the liver, kidneys, or heart, leading to their failure, which is often fatal in critically ill patients. 5. Meningitis and encephalitis. Cancer patients are at risk of infections in the brain and spinal cord, meningitis or encephalitis, leading to severe neurological damage, coma, and death. 6. Endocarditis. Bacterial infections can spread to the heart valves, endocarditis, causing heart failure or embolisms that can lead to strokes or other fatal complications. 7. Bloodstream infections, bacteremia, fungemia. Infections that enter the bloodstream via catheters, chemotherapy ports, or surgical wounds can quickly become systemic, leading to septicemia and multi-organ dysfunction. 8. Gastrointestinal infections. Severe infections from Clostridium difficile (C. diff) or other bacteria can cause colitis, perforation of the intestines, or deadly dehydration from diarrhea. 9. Opportunistic fungal infections. Weakened immune systems allow deadly fungal infections, like aspergillosis or candida, to spread uncontrollably, affecting the lungs, brain, or blood. 10. Urinary tract infections, UTIs, leading to urosepsis. Cancer patients, particularly those with urinary catheters or bladder cancer, are prone to UTIs, which can progress to urosepsis and death. 11. Surgical site infections. Cancer surgeries carry a high risk of post-operative infections, which, if untreated, can lead to abscesses, tissue necrosis, or systemic infections. 12. Tuberculosis TB reactivation. Cancer and its treatments can reactivate latent TB, causing severe lung infection or disseminated TB, which is often fatal in immunocompromised patients. 13. Viral infections e.g., COVID-19, influenza, CMV. Respiratory viruses like COVID-19 or influenza can cause severe pneumonia in cancer patients. Cytomegalovirus CMV can cause life-threatening complications in those undergoing bone marrow transplants. 14. Cancers associated with chronic infections. Some infections e.g., HPV, hepatitis B, C, or HIV, can accelerate cancer progression, leading to widespread metastasis, organ failure, and death. 15. Delayed or inadequate immune response. Cancer treatments suppress the immune system, reducing the ability to recognize and fight infections. This allows minor infections to escalate into life-threatening conditions. Preventing infections through vaccination, hygiene, early detection, and prompt treatment is critical for improving survival in cancer patients. Would you like more details on any of these? Obesity significantly increases the risk of cancer-related death through multiple mechanisms. Here are 15 ways obesity can contribute to mortality in cancer patients. 1. Increased inflammation. Obesity leads to chronic low-grade inflammation, promoting cancer cell growth, invasion, and resistance to treatment. 2. Hormonal imbalances. Excess fat tissue increases estrogen, insulin, and other hormones that fuel the growth of hormone-sensitive cancers like breast, ovarian, and prostate cancer. 3. Insulin resistance and hyperinsulinemia. High insulin levels promote tumor growth by stimulating cell division and reducing apoptosis, cell death. 4. Impaired immune function. Obesity weakens the immune system, reducing the body's ability to detect and destroy cancer cells. 5. Increased tumor aggressiveness. Obese individuals tend to develop more aggressive tumors, which are harder to treat and more likely to spread. 6. Poor response to treatment. Chemotherapy, radiation, and immunotherapy may be less effective in obese patients due to altered drug metabolism, higher drug resistance, and increased toxicity. 7. Higher risk of metastasis. Obesity creates a pro-inflammatory and pro-angiogenic, new blood vessel-forming, environment that enables cancer cells to spread to other organs. 8. Increased risk of blood clots, thrombosis. Cancer and obesity both increase the risk of deep vein thrombosis, DVT, and pulmonary embolism, PE, which can be fatal. 9. Complications during surgery. Obese cancer patients have higher risks of surgical complications such as poor wound healing, infections, and anesthesia-related issues. 10. Liver dysfunction and fatty liver disease. Non-alcoholic fatty liver disease, NAFLD, common in obesity, can impair liver function, affecting drug metabolism and increasing toxicity risks. 11. Higher cardiovascular disease risk. Obesity increases the risk of heart disease, which can worsen outcomes for cancer patients undergoing treatment. 12. Respiratory complications. Obesity-related conditions like sleep apnea and reduced lung capacity can make breathing difficult, especially during or after cancer treatments. 13. Increased fatigue and poor physical condition. Excess weight reduces mobility, worsens fatigue, and leads to muscle loss, making it harder for patients to tolerate cancer treatments. 14. Malnutrition and nutrient imbalance. Obesity can be associated with poor nutrition, where patients lack essential nutrients that support immune function and recovery. 15. Psychological and mental health impact. Obese cancer patients may experience higher rates of depression, anxiety, and lower treatment adherence, all of which can worsen survival outcomes. Because of these factors, obesity not only increases the risk of developing cancer but also makes the disease more aggressive and harder to treat, ultimately increasing the likelihood of death. Diet plays a crucial role in cancer progression and patient survival. Poor dietary choices can contribute to death in cancer patients in several ways. 1. Malnutrition and cachexia. Many cancer patients suffer from cachexia, severe muscle and weight loss, which can lead to organ failure. A poor diet lacking essential nutrients exacerbates this condition. 2. Weakened immune system. Inadequate protein, vitamins such as A, C, and D, and minerals weaken the immune system, making the patient more susceptible to infections, which can be fatal. 3. Increased inflammation. Diets high in processed foods, sugar, and trans fats promote inflammation, which can accelerate tumor growth and disease progression. 4. Excess sugar feeding tumors. High sugar intake can lead to increased insulin and insulin-like growth factor (IGF-1) levels, which promote cancer cell proliferation. 5. Obesity-related cancer progression. Obesity, often caused by poor diet, is linked to worse cancer outcomes. Excess fat tissue increases estrogen, inflammation, and insulin resistance, all of which fuel cancer growth. 6. Toxin exposure from processed foods. Preservatives, artificial additives, and chemicals like nitrates in processed meats are carcinogenic and can worsen cancer progression. 7. Nutrient deficiencies affecting treatment efficacy. A lack of critical nutrients like folate, iron, and B vitamins can reduce the effectiveness of chemotherapy or radiation therapy. 8. Uncontrolled blood sugar leading to organ damage. Poor dietary control of blood sugar can lead to diabetes, kidney failure, or cardiovascular complications, increasing the risk of death. 9. Poor gut health and dysbiosis. Diets low in fiber and high in processed foods can harm gut microbiota, reducing the body's ability to absorb nutrients and fight cancer. 10. High salt intake and hypertension. Excessive salt consumption can contribute to high blood pressure and cardiovascular disease, which can be fatal for cancer patients. 11. Excess alcohol intake. Alcohol is a known carcinogen and can worsen liver function, impair immunity, and promote cancer progression. 12. Interference with cancer treatments. Certain diets, such as extreme fasting or unbalanced fad diets, can weaken the body and reduce the effectiveness of medical treatments. 13. Severe dehydration from poor dietary choices. Insufficient fluid intake can lead to dehydration, kidney failure, and increased toxicity from chemotherapy drugs. 14. Gastrointestinal complications. Poor diet can cause severe constipation, diarrhea, or bowel obstruction, leading to complications that may require emergency medical intervention. 15. Electrolyte imbalances leading to heart failure. A poor diet may cause imbalances in potassium, magnesium, and sodium, which can lead to cardiac arrhythmias and sudden death. A well-balanced, nutrient-rich diet is essential for improving outcomes in cancer patients. Proper medical guidance is necessary to avoid these dietary pitfalls. Hormonal factors can contribute to the death of cancer patients in several ways, particularly in hormone-sensitive cancers such as breast, prostate, ovarian, and endometrial cancer. Here's how hormones can play a role in cancer progression and mortality. 1. Hormone-driven tumor growth. Certain cancers rely on hormones like estrogen, testosterone, or progesterone for growth. For example, breast cancer. Estrogen can promote the growth of estrogen receptor-positive, ER+ breast cancer. Prostate cancer. Testosterone fuels prostate cancer cell proliferation. If hormone levels remain high or are not properly managed, the tumor can grow uncontrollably, leading to metastasis and death. 2. Hormone resistance and treatment failure. Many hormone-sensitive cancers are treated with hormone-blocking therapies, e.g., tamoxifen, aromatase inhibitors for breast cancer, androgen deprivation therapy for prostate cancer. Over time, some cancer cells develop resistance to these treatments, making them more aggressive and harder to control. 3. Metastasis and organ failure. Hormones can influence cancer spread, metastasis, to vital organs like the liver, lungs, and brain. Once cancer spreads extensively, it can cause organ failure, which is a major cause of death in cancer patients. 4. Hypercalcemia of malignancy. Some hormone-related cancers can cause high levels of calcium in the blood, hypercalcemia, which can lead to kidney failure, heart problems, and coma. 5. Hormonal syndromes and secondary health issues. Some cancers produce hormones abnormally, leading to paraneoplastic syndromes that affect body functions. Example: small cell lung cancer can produce adrenocorticotropic hormone, ACTH, leading to Cushing's syndrome, which can cause infections, diabetes, and cardiovascular problems. 6. Impact on the immune system. Hormonal imbalances can weaken the immune system, reducing the body's ability to fight infections or respond to cancer treatments. Conclusion: while hormones themselves don't directly cause death, their role in promoting cancer growth, enabling resistance to therapy, and triggering dangerous metabolic changes can lead to organ failure, treatment resistance, and ultimately, death. This is why managing hormonal levels is a crucial part of cancer treatment. Alcohol consumption can be particularly dangerous for cancer patients, increasing the risk of death in several ways. Here are 15 ways alcohol can contribute to fatal outcomes. 1. Increased risk of cancer progression. Alcohol can fuel cancer growth by damaging DNA and promoting mutations, leading to faster tumor progression. 2. Weakening the immune system. Alcohol suppresses immune function, making it harder for the body to fight cancer and increasing vulnerability to infections. 3. Liver failure. Chronic alcohol use can cause liver cirrhosis or liver failure, especially dangerous for patients with liver cancer or those undergoing chemotherapy. 4. Increased risk of infections. Cancer treatments often weaken the immune system. Alcohol further reduces immune response, increasing the risk of fatal infections like pneumonia or sepsis. 5. Malnutrition and wasting, cachexia. Alcohol can interfere with nutrient absorption and appetite, leading to malnutrition and muscle wasting, which is already a major concern for cancer patients. 6. Interference with chemotherapy. Alcohol can interact negatively with chemotherapy drugs, reducing their effectiveness or intensifying toxic side effects, which can be life-threatening. 7. Increased bleeding risk. Alcohol acts as a blood thinner and can interfere with clotting, increasing the risk of severe internal bleeding, especially in patients with gastrointestinal cancers. 8. Exacerbation of organ damage. For patients with cancers affecting the liver, pancreas, or digestive system, alcohol accelerates organ damage, leading to organ failure and death. 9. Higher risk of stroke and heart disease. Cancer patients already have a higher risk of cardiovascular problems. Alcohol raises blood pressure and increases the risk of stroke or heart attack. 10. Worsening mental health and suicide risk. Many cancer patients struggle with depression and anxiety. Alcohol worsens mental health issues and increases suicide risk. 11. Increased risk of secondary cancers. Alcohol consumption increases the risk of developing additional cancers, e.g., liver, esophageal, breast, further complicating treatment and survival. 12. Worsening pain and inflammation. Alcohol-induced inflammation can worsen cancer-related pain, leading to increased suffering and complications. 13. Impaired wound healing. For cancer patients recovering from surgery, alcohol slows wound healing, increasing the risk of post-operative infections and complications. 14. Respiratory depression. Alcohol can suppress breathing, which is dangerous for cancer patients with lung involvement or those on pain medications like opioids. 15. Increased risk of accidental overdose. Alcohol can amplify the effects of painkillers and sedatives used in cancer treatment, leading to fatal overdoses. For cancer patients, avoiding alcohol is crucial to improving treatment outcomes and reducing life-threatening risks. Environmental pollutants can contribute to cancer progression and increase the risk of death in cancer patients in several ways. 1. Carcinogenesis and cancer progression. DNA damage. Pollutants like benzene, asbestos, and polycyclic aromatic hydrocarbons (PAHs) can cause genetic mutations, leading to cancer development and making existing cancer more aggressive. Inflammation. Chronic exposure to pollutants such as fine particulate matter PM2.5, heavy metals lead, arsenic, and industrial chemicals can cause long-term inflammation, which promotes tumor growth and metastasis. 2. Compromised immune system. Many pollutants, including pesticides and industrial chemicals, weaken the immune system, making it harder for the body to fight cancer cells and increasing vulnerability to infections. 3. Reduced effectiveness of cancer treatment. Air pollutants PM2.5, nitrogen dioxide, ozone can decrease oxygen levels in the blood, reducing the effectiveness of radiation therapy. Heavy metals and endocrine disruptors, like bisphenol A and dioxins, may interfere with chemotherapy by altering drug metabolism. 4. Increased risk of secondary cancers. Exposure to carcinogens like tobacco smoke, asbestos, and certain industrial chemicals can trigger secondary malignancies, worsening survival outcomes. 5. Organ damage and comorbidities. Pollutants such as heavy metals, lead, mercury, and air pollutants can cause heart disease, respiratory illnesses, and kidney damage, increasing the risk of death in cancer patients. 6. Worsened respiratory health. Lung cancer patients are those with metastatic cancer to the lungs or at higher risk of respiratory failure due to pollutants like PM2.5, diesel exhaust, and smoke exposure. 7. Epigenetic changes. Some environmental toxins alter gene expression without changing DNA sequences, potentially making cancer cells more resistant to treatment and promoting metastasis. Reducing exposure to environmental pollutants, improving air quality, and implementing protective measures can significantly improve outcomes for cancer patients.